Hi, my name is Kimberly Dickinson. I am a medical assistant instructor here with Kaplan College, and what we're going to learn today is hot and cold compresses. So depending on the injury will determine if you're going to use a hot or cold pack. So you have to wait for your physician's orders. Once you receive that, then we need to move on to the supplies. You're going to need some sort of a wrap bandage in case you need to put the pack and keep it in place. You're also going to need to use possibly a reusable hot and cold pack. This can either be put into the freezer, make sure it stays cold, or you can put it in the microwave if you need the hot. And it has the directions on the back side for you to make it hot. You'll need one of those. And you also need a barrier because you never put a compress that is either hot or cold directly on the skin. It'll cause injury. Please know that on your packs, there are several ways that you can do this. You can get the packs that have a cell on the inside that you squeeze, pop, and shake, and it can make them either immediately cold or hot. You can also get these gel packs. Some offices still use ice bags, make sure that they're small chips. Sometimes water bottles, but those aren't usually used anymore. So depending on the injury, that's going to determine what pack you're going to use. So let's say the doctor orders a hot pack. You've got your hot pack. Hot packs are typically used for muscle spasms, tension, usually what's up in the neck and the shoulder, local warming, partially for venipuncture, increasing blood flow to the site to help promote the healing. Additional things that you can actually use for a hot pack is also a heating pad. So a lot of patients don't have these at home. Let them know they can use their heating pad. One important thing to know about the heat pack, you never want to leave it on the injury for more than 30 minutes. If they leave it on for more than 30 minutes, it's going to cause what's called a rebound effect and cause more injury to the affected area. Cold packs. Cold packs are typically used in the case of a swelling. So if someone sprained their ankle, they're going to have a lot of swelling. Use a cold pack for that. You can also decrease blood flow in case there's a hemorrhage. So if there's a laceration, a lot of blood coming out, you can actually put a cold pack on it to help slow that down. And this will also numb the pain, especially from some sort of a muscle spasm. This is also something you do not want to leave on the skin for a long period of time. If you leave it on for more than 30 minutes, again, this also has a rebound effect, can cause more injury, and actually decreases the blood flow to the area, which can cause further injury. Now that you have gathered all your supplies, you have your physician's orders of applying a pack. Let's get started and I'll show you how to do that. And before you get started, you want to make sure you've washed your hands and you have gloves on. You always want to put gloves on just in case someone has an open contusion, possibly bleeding. You want to make sure you protect yourself and the patient. And this is Courtney. Hi, Courtney.
Hi.
Hello. So I'm going to be putting a compress on your left forearm. Is that okay with you? Okay, great. So first you want to assess, you want to look at the injury, see the site. The doctor told me he wanted it on her left forearm on the interior. And remember, you need to have a barrier in between. You're going to put that down first. Make sure when you put that on the patient, you're very delicate and easy, not pushing down. That's obviously an injured area. Then you have your pack. Put that lightly on top. If for some reason the pack is not going to stay in place, use a wrap, secure it in place, or it's going to slide off. If you'll lift your arm up a little bit, Courtney, thank you. As you are putting the wrap on, please make sure that you're not doing it too tight. If you do it too tight, you're going to cut off circulation. Then poor Courtney's arm is going to turn purple. You're going to have a worse injury. Go ahead and relax back down. Okay, so now that we have this on here, you want to leave it on for a good 20 to 30 minutes. If you leave it on for more than 30 minutes, you're going to cause continued injury to the patient. What happens is the minute the hot pack goes on, all of your capillaries and vessels, they open up. They feel the heat. There's a purpose why they're open. They're helping with the healing. After it being on for more than 30 minutes, all of those capillaries have that rebound effect I talked about earlier, and they constrict. Then you end up with decreased blood flow, which actually causes more injury. Same exact thing happens with cold. When you put the cold on initially, you have a constriction. Leaving it on there for more than 30 minutes, it starts to open back up, which will then increase the swelling, more blood flow to the area. Total opposite effect of what you wanted. So after you've had this on for 30 minutes, you're welcome to take it off. And how does that feel, Courtney?
Good.
Good. Once you take the pack off, you want to look at the area, note any changes in the skin color, note any increased bleeding, see how it looks. At that point, if it's not bleeding, there's no open contusion, as long as the patient feels well, you're good. You're going to take off your gloves, wash your hands, and then you're going to definitely put it in the chart. Always note everything that you do in a chart. If you didn't note it, it didn't happen. So now you guys know how to apply the hot and cold packs, and there are 3 things I want you to remember. Your packs, they have the directions. Remember to read those. They'll tell you how to make it hot, how to make it cold. Make sure you do not leave these packs on for more than 30 minutes. Remember, more than 30 minutes will cause injury. And you also need to make sure you check the skin before you put the pack on and after you put the pack on. Note it. Once you see it, remember to document it. Remember, if it didn't get documented, it didn't happen. Guys, thanks so much for being with me. Good luck and go compress your hearts out.